Welcome. I'm joined here by Dr. Tor Bengtsson, the professor of the Department of Molecular Biosciences at Stockholm University. It's a pleasure to have you here, Doctor. How are you?
Thank you. It's a pleasure to be here.
Great to have you here. Can you start by introducing yourself? Tell us a little bit about your professional background to get us going.
So, as you said, my name is Tor Bengtsson. I'm a professor at Stockholm University, and I've been working with physiology my whole life, especially obesity and type 2 diabetes and metabolic disease. And my specialty is actually adrenergic signaling, and at that coupled with brown fat, this fantastic tissue that actually produces heat. I'm also the founder of two companies. One company is called Secret Therapeutics, and the other company is Atrogi, both battling type 2 diabetes and pre-diabetes.
Got it. Okay, now BioRestorative Therapies is research and development. It's a company whose goal is to use stem cell research and to develop stem cell delivery protocols that are helping the body heal itself. So you just talked about the brown fat stem cells. Can you give us more insight into what ThermoStem is and how that works?
Yeah, ThermoStem is actually very interesting because what BioRestorative is trying to do is actually taking stem cells and making them into something which is called brown fat or brown adipocytes, and then take these fat cells and put them back into the body. So the question is, why would that be good? Brown fat is actually tissue which is very, very important because it produces heat, and it actually is in almost all mammals. And why is that important? It's because this tissue is one of the most energy consumption tissues in the body. So they can actually consume a lot of energy and burn it to produce heat. And if you don't have this brown fat, you actually can become obese and you can get a lot of metabolic problems. So what BioRestorative is trying to do is to actually take cells, stem cells, make them into these brown fat cells, and then put them back. And I think this is a super interesting thing, and I think it could have tremendous impact actually in how people, patients could actually get better in their metabolic health.
Got it. Now, you have a research collaboration with BioRestorative Therapies. Can you give us a little more about what you do in assisting BioRestorative with their ThermoStem and the brown fat program, and how far you've gone thus far in your research regarding treating these metabolic conditions?
Yeah. Okay, I think mostly you have to understand what brown fat is doing. As I said, it's producing heat. So think about a cell that actually have a little oven in them. So this little cell has this oven, and you can turn on this oven, and the oven actually use energy. It uses some energy to produce this heat. And what energy this brown fat cell is using is actually sugar and fat. So if you can start this cell, it will suck energy from the blood into the cell, and then turn that energy, that sugar and lipids into energy and heat. So what we are trying to do is actually taking BioRestorative's cells, and these cells, we can actually push them, because they are stem cells, push them to become brown fat cells. And by actually doing this, we put that oven into these cells. So you get that little oven that can produce heat. And we are able to actually measure how this oven functions, how much heat this oven produces. So what we are trying to do is to take these very nice cells that BioRestorative have given us. We take these cells, we put them into a cell culture dish, and then we promote them to become brown fat cells. And then we can actually measure how much heat that comes out of that cells. That sounds very easy, but it's very, very difficult to measure heat from just a couple of cells. 100,000 cells. It's very, very few of them, but we can measure that heat. So why is that important? Because if we can do that, we can understand how these cells actually make the oven, how you start the oven, and also how you produce heat. That mechanistic insight can be used to actually be able to put these stem cells back into the body of a patient, and then the patient would actually benefit very much from this. And you can think about that this patient would actually get better metabolic health in many contexts, because these cells, these brown fat cells, will burn sugar and fat.
Amazing. Now, from your expert standpoint too, what makes ThermoStem and the use of brown fat innovative compared to what else is on the market right now for the treatment of some of these metabolic disorders?
Yeah, it's a very good question. And as I said, I've also started a couple of companies where we're trying to, of course, battle metabolic diseases. And what you normally do is that you make a small molecule that treat type 2 diabetes or obesity in some way. So that is a small molecule that you eat as a pill or give in some other ways, oral or whatever. That is the normal way. We also have a number of other kind of novel ways where you maybe eat something that is not taken up into the bloodstream, but changes the body, how much you take up of the energy in your food and so on. But BioRestorative is doing something that is really, really unique. They're trying to restore the physiological function of a tissue, because normally brown fat, you have that when you're small children, you have a lot of brown fat, but when you get older or you get obese, you can lose a big portion of your brown fat. And what BioRestorative is trying to do is actually to put back that function, to put back that tissue to its normal function. And I think that is really unique. It's really exciting, and I really hope it will work in the future. And I think it has high hopes to actually get a very good treatment for a number of different diseases.
Fantastic. Now, any further key insights, key takeaways about ThermoStem that you want to reiterate or share as we close out here?
I think, basically, I think that BioRestorative is actually doing something that is very, very frontline in the science. They're doing a very important task. They're trying to take stem cells. They are trying to make this, or they have actually proven that they can do it. They put this into a brown fat cells, and we are trying to help to actually measure the heat coming from this. And if you can then prove that you can put this back into humans, and that will actually treat a number of diseases, that is, of course, a fantastic achievement. And there are a number of publications out there actually pointing in this direction. So I think this is a very exciting endeavor, and I'm happy to be involved in it.
Fantastic. Dr. Tor, it's been amazing discussing with you, hearing everything you're working on with BioRestorative Therapies. Thank you so much for joining us today.
Yeah, thank you.